Good morning, everyone. Thank you for joining us. I'm pleased to be here with Congressman Bobby Rush, who sponsored the bill on the House side and has been a champion as he was committed to this from a personal commitment, and he's going to speak to us shortly. He's got a vote that is taking place. Did the vote start? Let's start. So I'm going to ask Congressman Rush to go first. He's got a vote that's taking place, and we don't want him to miss that. Congressman Rush.
Thank you so very much, Senator Menendez, and I want to thank you so much for your leadership on this particular issue and other issues associated. Some 10 years ago, almost 10 years ago, my attention was riveted toward the television news in Chicago as the headlines spewed the fact that there was a mother of a young girl missing. And after about 3 days, I think it was on a Saturday afternoon, the headlines repeated the story and said that this mother had been found on the streets of on the north side of the city of Chicago, where she had plummeted to her death. I'm talking about Melanie Blocker Stokes. And Melanie lived in the area that I represented as a member of the city council. I knew the Blocker family. I later discovered that Ms. Carol Blocker had been the teacher at two of my grandchildren's schools. She was their 5th grade teacher, but I didn't know that at the time, but I did know the Blocker family. And then upon further inquiry, I found out that Melanie had suffered from something called postpartum psychosis. I knew nothing about it, but I kept hearing about mothers. As a matter of fact, within a short period of time, 2 other mothers in Chicago had taken their lives based on this particular issue. And I've wondered, I said, what can I as a congressman, what can I do and what can we do? And I talked with some folk and we came up with an idea to sponsor legislation and I named it after Melanie. To deal with this issue of postpartum depression and postpartum psychosis. To me, it was most important that this Congress recognize the fact that this was an issue and that this issue, had it been an issue that affected men, it would have been an issue that would have been dealt with in short order. But to my surprise, as I was gathering, this was almost 10 years ago, as I was gathering co-sponsors for this bill, I was surprised and astounded at the number of members of Congress who were very familiar with this issue and who had a loved one, who had a family member, who had an acquaintance that had suffered from this postpartum psychosis. As a matter of fact, one of the leading members of this House, of the House of Representatives, still is, one of the outstanding historical members of great note to the American people, said that his first wife had postpartum depression. And so it was a malady that most members of Congress were very familiar with. I'm just so proud now that Senator Menendez and others have worked tirelessly to make this a law, to include this in the health reform measures that we just passed. This is a day that the American woman, the American women celebrate. This is a day that as we stand on the threshold of Mother's Day, the Congress of the United States and the American government can give our mothers a Mother's Day present that we keep on giving. It's a gift that will keep on giving for generations to come. And this is just the beginning of our embracing and our embarking upon an issue that affects women. Women's health issues should be a prime concern to this House of Representatives, to this Senate, to the Congress, as it should be to the American people. And so we can't stop now. There are other issues that are particular to women. And as I reflect upon my own mother, who's passed on now, she's in glory, I'm doing this because I want to honor my mother on this Mother's Day. And I want to make sure that I know she's celebrating in heaven, but I just want to celebrate her because she was the mother of 8 children, and she didn't have this opportunity. I want to thank Carol Blocker for the tremendous work that she's done. I want to thank everybody who's involved in this, everybody who's participated. I've got to run back and vote. So thank you, Senator, for your contributions. I appreciate you.
Thank you, Congressman. Congressman Rush made a promise to Mrs. Blocker, and a promise made and a promise kept. And so we appreciate his leadership. I'm pleased to be here not only with Congressman Rush, but with an effective group of advocates today. I think today we celebrate a victory for women everywhere, a gift for Mother's Day for all new mothers who suffer the agony of postpartum depression, all who have worked tirelessly to make the Melanie Stokes Blocker Mothers Act a reality. I want to thank my colleague Senator Durbin, who is the counterpart to Congressman Rush from Illinois, who joined us in this effort. Mrs. Blocker, who is here and is going to speak shortly. We're pleased that we could be here with you today. This is for your daughter's memory. To Susan Dowd Stone from Postpartum Support International and Catherine Stone of the Postpartum Progress website. I know they both work their hearts out every day to make sure that new mothers who might face this challenge would never be alone again. You made a real difference. To Sylvia Las Alondra, a survivor and author of A Daughter's Touch, her compelling story of her struggle to share with so many other women. Thank you, Sylvia, for what you did. I want to thank the groups who are tireless supporters in the midst of some I would say fringe elements who try to suggest that there was something wrong with this legislation. Certainly the expertise and the advocacy of the American Congress of Obstetricians and Gynecologists and the American Psychological Association were very important. And we would be remiss if we didn't take a moment to acknowledge the support of a good friend and a tireless advocate for women. When I started this journey in the Senate, he was strongly supportive, and that's the late Senator Ted Kennedy, who is smiling down on us today. So to all who I've mentioned and to the many advocacy groups represented here, thank you for being true champions of the law and a key part of its success. We all know why we're here. We're here because mothers nationwide who are suffering from postpartum depression finally will get the support they need because of the Melanie Blocker Stokes Mothers Act. We're here because we know the importance of meeting the challenge of postpartum depression on multiple fronts, with education, with supportive services and research, so that new moms can feel supported and safe rather than scared and alone. The Mothers Act, which is now the law as part of the health insurance reform that Congress passed and the President signed into law, will go a long way to provide that support. It will help new mothers suffering from postpartum depression to feel safe, to help them get through it, to help researchers get to the bottom of it. And with the National Public Awareness Campaign, the Mothers Act will shine a needed light on the seriousness and devastation that postpartum depression can bring, so that new mothers and the general public better understand it and understand help is available. I've always said, while our focus is on mothers, this is about families at the end of the day. It's about the child that was just born and the relationship with their mother who are suffering from postpartum depression. It's about the husband, it's about the grandparents, it's about everybody in a family coming together to help meet this challenge. I'm confident the law will be the beginning of a long-lasting and effective federal effort to combat this debilitating condition. The fact is, this legislation tells every American that postpartum depression is a national problem that deserves and demands a national response. The law is a symbol of our commitment to help mothers who suffer from this disorder. It will help educate new moms, their families, and every American about the torment of postpartum depression and what it can do and how it can be met. It will open avenues of research into causes, diagnosis, and treatment of postpartum depression that affects between 10 and 20%. 10 and 20% of all new mothers, as many as 800,000 new cases each year. 11 to 16,000 new cases in my home state of New Jersey, where our former First Lady ultimately did a tremendous job, Mary Jo Cody, who made a tremendous effort and had a state law passed that is the impetus to a lot of what we did in this legislation. And it encourages the creation of programs to give grants to community organizations, hospitals, state and local governments to support local support services. Hopefully over time we'll see those support services spring up in every city and community, because postpartum depression knows no boundaries, no race, no economic class. The bottom line is this law makes postpartum depression a national issue, and that's a victory. It sets us on a path towards better understanding the condition over the next 2 years and finding the best ways to promote the most effective screening and diagnostic techniques. And one more thing worth noting. With health insurance reform signed into law after a long fight, one important thing to come out of it is that all new insurance plans will be required to cover comprehensive women's preventative care and screening. That's the law. That's a major victory for all women, and I'm proud to have voted for it. So I know, in speaking to so many women who have experienced the overwhelming sadness, the unbearable thoughts, the emotional nightmare of postpartum depression, that this law is not only badly needed, but it was the right thing to do. As a community, we have an obligation to help all new mothers who need our help. And I know that that's a perfect gift to give mothers across the landscape of this country this Mother's Day. And on that note, let me introduce a mother who suffered through the consequences of the worst part of postpartum depression with the loss of her daughter, Carol Blocker.
Is this ready for me? Yes. Okay. First of all, I can't thank Senator Menendez and Congressman Rush enough for helping to pass this bill. I've always said that most men are not interested in women's illnesses, but they were. And from the bottom of my heart, I thank them. Melanie's first Mother's Day was spent in a mental hospital. When we brought Summer for her to see that day, I told Sam, I said, Sam, when Melanie sees Summer dressed in this beautiful little outfit, I said, she's gonna get better. And when we walked in the door of the hospital, Melanie took one look at her and walked to the window and stared out of the window. And I knew then that something terrible was wrong, and I had to do something. I never dreamed that my daughter would die in the manner that she did. But this is the best Mother's Day present that I can give her, is for her life and this cause to save other mothers, to help other mothers, mothers that are in need. Family members call me constantly and ask me, where can I take my daughter? She's suffering from what your daughter had. And you know what I tell them? I don't know, because nothing has changed. So I thank everyone that has helped to make this bill pass. And I know that Melanie is smiling down saying thank you to. Thank you.
Thank you, Mrs. Blocker, for both having shared that story early on, which was compelling, and for being such a tireless advocate to make it a reality. Susan Stone, she's the chair of the President's Advisory Council, Postpartum Support International, and was just a tremendous advocate in this regard. Susan.
Good morning. I'm so glad you could all be here today on this very historic occasion. Three of the women standing behind me, Carol Blocker, Catherine Stone, and Sylvia Las Alondra, are mothers who have suffered. It's not easy to stand up in front of a group of individuals in this country who have such preconceived notions of motherhood and talk about an experience that was less than perfection. Today, America catches up with other civilized nations in the world who have understood and embraced the entire experience of motherhood with all of its joys and sometimes with its sorrows. And our country is now standing behind the 20% of American mothers who will experience a diagnosable perinatal mood disorder this year. We are eternally indebted to U.S. Senator Robert Menendez for his untiring leadership on this issue. It's a cause that can be dark and hard to take up when you're speaking about challenging something as entrenched in American life as the motherhood myth. But thanks to champions like Senator Menendez and Congressman Bobby Rush, who listen to their constituents, truly represent them, and take their issues to the country, to the Senate, to the Congress, and argue tirelessly for them, American mothers are being recognized in a way they have never been recognized before. This is indeed a magical, historical day for any woman. In no other condition does the mental health and well-being of one individual so directly affect the mental health and well-being of another. This is a real twofer. This is not a waste of dollars. This is saving lives, saving human beings, offering a healthy chance for development. PSI has coordinators across the country and live chats to help women. And Healthy Mothers, Healthy Babies has a texting program to send messages to mothers at high risk. So we intend to reach every mother wherever she is, thanks to the funding that will be offered by this act, so that all of mothers can have the services and support that they deserve. Thank you, all of you. And remember, we need to continue to keep the pressure on until this bill is funded and until there are programs in every community across the country. Thank you, Senator Menendez, and thank you, Congressman Bobby Rush.
Catherine Stone is the author of Postpartum Progress and was constantly out there talking about truth against some of the misinformation about the legislation as it was moving through, and made it help us make it a reality. So, Catherine.
As a mother who has been through a form of postpartum depression, I can tell you that today is a very special day because it gives us validation. There are 1 million women right now in this country potentially who are suffering deeply, who are unable to celebrate on Mother's Day because they feel deeply sad, they feel disconnected, they feel very sick, and they don't know what's wrong, and they don't know where to turn to get help. In 2001, when it happened to me, I did not know where to turn. I did not know where to get help. I did not know what was wrong, and I thought my life was over. So I thank, from the bottom of my heart, Senator Menendez and Representative Rush and all the members of the Senate and the House of Representatives who voted for this bill and made sure that it was passed, because you have given validation to a very serious illness and to the women who experience it. It's just a start, but it's a way of recognizing the reality and the commonality of this illness. And we're going to go forward from here and make sure, as Susan said, that every woman, regardless of her race, her socioeconomic status, has access to the kinds of services where people immediately recognize what's going on with her, know how to help her, and can make her feel as though what she's going through is temporary and treatable, and that she can get back to the business of living her life, being the person that she is and being a wonderful mother. So again, I'm eternally grateful, and for the many women who I represent who read postpartum progress, we all say thank you.
Thank you. Sylvia Las Alondra, she is the legislative director of perinatalpro.com and the author of A Daughter's Touch, and her own personal story has always been one of those that has given us a catalyst to achieve today. So Sylvia?
Good morning. I need to always bring these down, I'm sorry. Thank you for all coming here. I want to start off by thanking Congressman Bobby Rush and our New Jersey U.S. Senator Robert Menendez for all your hard work, and Carol Blocker, who I can't put into words the sacrifices and the despair you went through. I love you and I thank you for never giving up the fight. And I am honored to stand here alongside Susan Stone, Catherine Stone, and a woman who's not here, the former First Lady of New Jersey, Mary Jo Cody, who's started this 23 years ago. I'm going to keep this very brief, and I promise I won't curse. This is a very hard thing to do. You know what they say about the Jersey girls, and I'm truly a Jersey girl. At times, I have to be honest with you, I never thought that this bill would come into fruition. And I never thought I would celebrate this day. In fact, there were days that I thought just speaking about it, nobody would ever truly listen to what had happened to me and all the other women who suffered from this very debilitating, very real illness. Each time I spoke, I had to relive those dark moments of doing the unimaginable, unthinkable, and almost taking the life of my daughter, Melina, and almost taking my life. Because of the passage of the Melanie Blocker Stokes Mothers Act, women would no longer feel alone and ashamed and too afraid to stand up and ask for help. This bill is way long overdue. 10 years ago, I almost took my daughter's life. I wanted to end her life and then end mine. I suffered from an illness that couldn't be seen. There was no vomiting, there was no fever, no open wounds. In fact, people questioned if I was sick at all. It left an open gash in my heart. The bleeding stopped, but there's not a day that goes by that I don't think of how close I came to doing the unthinkable. And if you think about that, it gets easier each day and every year. Melina's now 9. And when I look into her eyes, I am constantly reminded of what I almost did to her. I cry. At moments, I can't even get out of bed because of the thoughts from 10 years ago. There's 800,000 women as we speak suffering now, not including the fathers, the grandparents, the uncles, the cousins. Everybody suffers from this illness. I look at her first photos from her first 9 months. She lived with my parents. And it's sad to say that I have not one recollection, not one memory, because I was so sick. The only memories I do have is when I dust the photos that are sitting on my shelf and I see Melina in her crib. At times I look at those photos and think, wow, how close did I come to smothering her? Today we celebrate the passage of a historic bill, a bill that would help save countless women and families. Carol, I want to end this by thanking you for never ever giving up again, and for the courage to stand up and to speak. I know there were times I called you and we both felt the same way, the frustration. Would this bill pass? Is anyone listening? Well, guess what? Senator Menendez, Congressman Bobby Rush, Durbin, Cody, I can't mention everybody because I'll be here all day, have listened. The most sacred gift on this planet is a mother. All the reassurance a mother ever needs, or child ever needs, I'm sorry, is written on a mother's face. We must protect our women. And this is just the beginning. This is not the end. We need to get the cash. And that's what we have to do. I will not stop until we get the proper funding and we see this to the end. Let's not back down. Let's keep going forward. This is not a time to sit there. It's time to run. We have it, and we passed the baton, and now it's for all of us to continue this work that Senator Menendez, Carol Blocker, and Melanie Stokes has done for us. Melanie Stokes is smiling today, and she's so proud of you, and there's not a day that goes by she doesn't think of you in summer. Thank you again, Carol. Thank you, thank you, thank you.
Thank you, Sylvia.
I got it.
Dr. Albert Strunk is the Vice President of the American Congress of Obstetricians and Gynecologists, and we appreciate his organization's advocacy all along with us.
Good morning. I'm Al Strunk. I'm the Vice President for Fellowship at the American Congress of Obstetricians and Gynecologists. We represent 53,000 obstetrician gynecologists and other partners in women's health care. We're here this morning on this glorious Washington, D.C. day to do two things. One, to thank Senator Menendez and Congressman Rush and all of those who have made this bill possible, and to, of course, celebrate the passage of the bill and the benefits of this legislation. As you've heard, postpartum depression is one of a number of perinatal meaning around the time of delivery, mood disorders that occur immediately after pregnancy and up to 1 year following pregnancy. And as was said, occurs in 10 to 20% or 400 to 800,000 women per year. So this is a significant public health issue. And while the disorder is more prevalent than any of us might have expected, research on causes and treatment are very limited. So because we know so little, women often suffer in silence, and they don't seek treatment because they feel embarrassed, sometimes even guilty for their feelings. Too often, the joys of new motherhood are short-lived or non-existent due to perinatal depression. And as was pointed out so poignantly by both Congressman Rush and Mrs. Blocker, this is not a quality of life issue. We have become deadened to the phrase quality of life, but this is an issue about saving lives as well, saving the lives of new mothers and new infants. No woman should be left in the dark during these tough times, and this act will bring depression out of that darkness so that moms can get the care they need. We expect the law to not only increase awareness, but expand research and establish cost-effective services for women and their families. So the bottom line is that the new law will ensure that women and their physicians have the very best tools available to identify and treat women who suffer from this very real, very serious matter of perinatal depression. So again, I would like to thank Senator Menendez and Congressman Rush and all of those who have worked to bring this legislation to fruition for this most important work. Thank you very much.
Thank you, Doctor. And now our final speaker, Dr. Gwendolyn Kita, who is the Public Interest Director of the American Psychological Association, also another professional group that gave us enormous help in this process. Doctor.
Thank you. The American Psychological Association is very excited about the passage of the Mothers Act and applauds Senator Robert Menendez, Representative Bobby Rush, and Senator Richard Durbin for their leadership and tenacity. American Psychological Association members are all too familiar with postpartum depression. Dr. Alexis Menken, a clinical psychologist in New Jersey, notes that one of the greatest difficulties she observes is when a woman comes into her office with a postpartum mood disorder, and she can see the woman's lonely struggle with feelings of guilt and shame. Dr. Susan Feingold from Illinois tells the story of a new mother that comes in for a session after being referred by her physician, midwife, doula, lactation consultant, or perhaps a friend or relative. During their initial intake session, she reports symptoms which may include severe anxiety, panic attacks, depressed mood and/or distressing obsessive thoughts. In addition to taking her history, getting a symptom picture, and starting to develop a treatment plan, she begins to educate the postpartum mother about postpartum depression. She also discusses a potential individualized treatment plan. At this point, the postpartum mom has a name for the illness that she's experiencing, realizes that she is not alone, that there is hope, and a very good prognosis for full recovery with short-term psychotherapy, sometimes medication, and possibly a support group. The Mothers Act provides the validation and support that up to 25% of new mothers need when they are privately feeling terrible and possibly having terrifying thoughts about harming themselves and or their babies. We are confident that not only will the Mothers Act save lives, it will provide the education, training, knowledge, and research to support all new mothers, their families, and their health professionals. Thank you.
Thank you very much. Thank you. With that, any questions? If there are not, happy. Oh, I thought I was getting away with it. So go ahead.
This question is for Mrs. Blocker.
Mrs. Blocker.
Yes, honey.
What steps,
Another shorty. Yes?
what steps will you now take to raise the funding needed, and about how much do you think will you need ultimately to make a difference?
Now, you know, honey, I'm going to be honest with you. I can't answer that because I don't know. This is all so new.
Let me help you with that.
Would you?
Well, let me stand here with
Yeah,
me.
okay.
Let me help you with that.
I don't want to say.
Our goal is to now go through the appropriations process and bring $3 million into the grants programs. The law already calls for a national awareness campaign, and that will be directed by the Department of Health and Human Services. And also we'll be looking at research efforts to make sure we get to the cause, the root cause of postpartum depression. But as it relates to the program so that people can begin to provide some of the work that these organizations do throughout the country, about $3 million.
And do you plan to actually take part in raising awareness, continually to raise awareness back in your hometown or across the nation?
Yes, absolutely. You see, first of all, in my hometown, which is Illinois, there are 5 women that have been at Dwight Penitentiary and Lincoln Penitentiary for 20 years for harming their children. They're paying a price for something that postpartum psychosis did, not them. And yes, will continue to raise awareness and help these women to get out of prison and to help any woman suffering for as long as I have breath.
Anyone else? If not, happy Mother's Day to all of those who are mothers this coming Sunday. Have a great day.